Did you know, for decades, animal-assisted therapy has assisted in treating many mental health conditions, including addiction? I'm Jessie, and this is Edgar. Animal-assisted therapy encourages the human-animal bond as a way of nurturing long-term goals. You've likely seen therapy pets supporting people in everyday life: the dog in the movie theater, the grocery store, or on the airplane. And I'll bet you're familiar with that instinctually warm feeling you get from a pet. Who doesn't soften at the happy tail wag of a dog or feel soothed by a purring cat? But did you know that many in recovery are finding therapeutic value in developing this kind of bond with animals? A review of 69 studies on human-animal interactions revealed benefits to interpersonal interactions, mood, stress responses such as cortisol levels, heart rate, and blood pressure, and affect outcomes for certain cardiovascular disease. You've probably heard the name Sigmund Freud, the founder of psychoanalysis. But did you know about Jofi, his closest canine companion? In the 1930s, Jofi sat in on almost every one of Freud's therapeutic sessions with patients. And in the 1960s, one of the pioneers of animal-assisted therapy, Dr. Boris Levinson, documented his experiences with Jingles, a dog he referred to as his co-therapist. Both Freud and Levinson noted that their pet's presence in the room reduced anxiety in their patients, eased traumatic stress, and provided temporary relief for patients wrestling with obsessive tendencies. Animal-assisted therapy is meant to complement ongoing therapies such as group and individual counseling, psychotherapy, and medication management throughout treatment. In 2009, animal-assisted therapy was tested in the treatment of substance use disorders. A total of 231 people took part in this research study, where one group received 26 group sessions with a therapy dog present, and the other group received the same 26 group sessions, but without a therapy dog. Using the Helping Alliance questionnaire, the group with the therapy dog reported a more positive opinion of the therapeutic alliance and overall group experience. Since then, several studies have validated these findings in treating veterans for PTSD, or within adolescent inpatient settings, outpatient treatment facilities, and correctional facilities. You may have also heard the phrase animal-assisted activities. This is different from animal-assisted therapy. Let's clarify the main distinction between these two. Animal-assisted therapy is a directive intervention with a specific therapeutic purpose. For example, someone with oppositional tendencies will learn to walk a dog to build empathy, or someone with anxiety-related symptoms will spend time grooming a horse to de-escalate stress. Animal-assisted activities, however, are much less goal-directed and more casual meet-and-greet experience. For example, trained volunteers can bring a therapy dog into a nursing home to stimulate elderly patients, or in many adolescent addiction treatment academies, animal-assisted activities are presented as recreation. These activities have demonstrated a reduction in cortisol, a hormone associated with stress level following the interaction with a therapy animal. Not only do animal interactions impact physical and psychological health, but these interactions help people focus on something outside of themselves. Active addiction causes most people to adopt a lifestyle that centers purely on their own needs, ignoring the needs and feelings of others and those close to them. Animal therapy promotes care and nurturing of another, helping patients understand what it means to be nurtured and cared for themselves. If you would like a free guide that summarizes the benefits discussed in this video, connect with us by sending an email to learning@phoenixhouse.org. Thanks for listening, and now you know.